Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic liver disease. It is caused by the hepatitis B virus HBV, which is transmitted through contact with infectious body fluids, such as blood, semen, and vaginal fluids. Hepatitis B is a major global health problem and can lead to serious liver conditions if not properly managed. Transmission: hepatitis B is primarily transmitted through contact with infectious blood, sharing needles or syringes with someone who has HBV, receiving contaminated blood products or organ transplants, though this is rare due to screening, sexual contact, unprotected sex with an infected person. From mother to baby. An infected mother can't transmit the virus to her baby during childbirth. Exposure to contaminated blood products. Contact with blood from an infected person, such as in healthcare settings or through non-sterile tattooing or piercing equipment. Sharing personal items. Sharing items that may be contaminated with blood, like razors or toothbrushes. Symptoms: hepatitis B symptoms can vary from mild to severe and may include acute hepatitis B, jaundice, yellowing of the skin and eyes, abdominal pain, especially in the upper right side of the abdomen, fatigue, feeling unusually tired or weak, nausea and vomiting, feeling sick to the stomach and vomiting, loss of appetite, reduced desire to eat, dark urine. Urine may appear darker than usual. Light-colored stools. Stools may be pale or clay-colored. Joint pain. Pain in the joints. Chronic hepatitis B. Many people with chronic hepatitis B may not have symptoms until significant liver damage occurs. Symptoms can be similar to those of acute hepatitis B but are usually less noticeable until the disease progresses. Diagnosis: hepatitis B is diagnosed through medical history and physical examination, review of symptoms, risk factors, and possible exposure to HBV. Blood tests. Hepatitis B surface antigen HBsAg detects the presence of the virus. Hepatitis B surface antibody anti-HBs indicates recovery and immunity if positive. Hepatitis B core antibody anti-HBc indicates past or current infection. Hepatitis B DNA test measures the amount of HBV in the blood viral load. Liver function tests to assess liver damage and function. Liver ultrasound or imaging to check for liver inflammation, fibrosis, or cirrhosis. Liver biopsy or FibroScan to assess the extent of liver damage or fibrosis. Treatment for hepatitis B depends on whether the infection is acute or chronic. Acute hepatitis B. Supportive care, rest, hydration, and a healthy diet. Antiviral medications, rarely needed, but may be prescribed in severe cases to manage symptoms. Chronic hepatitis B. Antiviral medications, to reduce the viral load and prevent liver damage. Common medications include tenofovir, entecavir, and lamivudine. Monitoring, regular follow-up with blood tests and liver function assessments to monitor the effectiveness of treatment and liver health. Lifestyle modifications, avoiding alcohol and maintaining the healthy diet to reduce liver strain. Liver transplant may be necessary in cases of severe liver damage or cirrhosis. Preventing hepatitis B involves several strategies. Vaccination. Hepatitis B vaccine, the most effective way to prevent infection. It is recommended for all infants, children, and adults at risk. Safe practices. Avoid sharing needles. Use only sterile needles and syringes. Safe sex practices. Use condoms to reduce the risk of transmission. Safe medical procedures. Ensure that healthcare providers use sterile equipment and follow infection control practices. Screening and testing. Regular screening for high-risk individuals, such as those with a history of drug use or those who are pregnant. Post-exposure prophylaxis. Hepatitis B immune globulin HBIg and vaccine, for individuals exposed to HBV, such as through needle stick injuries or sexual exposure. post-exposure prophylaxis can help prevent infection if administered promptly. Prognosis: acute hepatitis B. Most people recover fully within a few months. In some cases, it can progress to chronic infection. Chronic hepatitis B requires ongoing management to prevent liver damage and complications. With appropriate treatment and lifestyle changes, many people with chronic hepatitis B can lead healthy lives. Conclusion: hepatitis B is a serious viral infection that affects the liver and can lead to significant health complications if not properly managed. Vaccination, safe practices, and regular monitoring are crucial for prevention and management. If you have concerns about hepatitis B or potential exposure, seeking medical advice for diagnosis and appropriate care is essential.